Council, Jessica Forsyth, thank you for joining us. We have Kent City Council member Satwinder Kaur. I'm seeing Hina. I see Mommy. Y'all, Mommy's on the Zoom. Yay. Carrie Williams, Rosa Franklin. Oh, it's not Rosa. That's Sarah. Thank you for joining us, Roger, Alex, Lucia, and Carol, and Lisette, and Mike. Thank you so much for coming tonight. And I'll be doing some introductions of our panelists tonight, along with our fearless leader on healthcare access, abortion access, with Representative Milan Tai. We get into some good trouble down in Olympia. I'm gonna need you to take your thing off mute because I know you are chomping at the bit to get us started today.
Well, yes, thank you, Jamila, and I hope that it's okay that we're doing this sort of like on a first name basis. We are here really. First of all, really thank you for your support and for you to be in this space. I mean, this is the critically important part of our success, right? I mean, when we educate ourselves, when we know exactly what in front of us, we better advocate for the issues that is really near and dear to our hearts. Because I don't know if Jamila and Lisa, the another wonderful legislator on this Zoom with us, know is that legislators can only be successful so much. We couldn't push anything without you. You are the force behind these important work. And so first and foremost, I want to thank you. I want to thank you for being in this space, learning with us, and supporting our effort. So my little bill, 1851, that increase really access to abortion care for Washingtonian. And you know, we all agree that health disparity has been the conversation in multiple spaces. And we all saying it at one point or another that COVID has heightened and elevate and showed health disparity in terms of services, in terms of care, in terms of accessibility, a numbers of time repeatedly. So abortion care, abortion access is not any different. So yes, we could pat ourselves in the back once in a while, thinking that Washington State is pretty cool when it's come to reproductive care, is pretty cool and progressive when it's come to ensuring that people get the services that they deserve. And I feel very comfortable using the term deserve because this isn't about one group or another. This is about the well-being of all of us, and this is how we build community to thrive, right? And so 1851 is number one, to ensure that providers, not just MD, not just medical doctor, could provide abortion care, because we know there's other providers, as long as they practice within their scope of practice, as long as they have the training necessity, and we know that within Washington State there's a lot of pockets that patients, our own families and neighbors could not have access to some of these reproductive care, and having that expansion definitely increase access to abortion care. The second important piece to that legislation is that science have moved us into the space where it's absolutely amazing, and we should celebrate it, is that individual will need reproductive care, regardless of their gender identification. And when an individual who is pregnant needing these reproductive care in the entire spectrum, we need to make sure that they are seen, and that they are affirmed to receive these services. And really, last but not least, and this was really the work in collaboration with our Attorney General office, is to ensure not only the government in Washington State will not in foreseeable future criminalize those who provide services and those who aid people who need it in order to get the services, who needed the help. But we as the government will stand up and protect. It's not just passively not criminalizing, but actively protecting the people who providing the services and the support for these individuals. And so it's a critical piece of legislation as far as moving us forward. And the priority for next session is like, we're not stopping. We is not stopping until health disparity is no longer the thing. Right? And especially disparity when it comes to services for reproductive healthcare is no longer the thing. And so with that, I am open up and start our conversation. Representative Taylor.
Yes, yes. And so one of the things that is really critical in this time, like we know Roe is under attack, and it's been under attack since it was, decided in 1973, 2 years before I was born. And one of the things that was really critical for me in this conversation is, not just reproductive care and having access to abortion care, but also reproductive care in terms of doulas, birth doulas. Like last session, we passed a House Bill 1881. We also wanted to address disparities in maternal health care. We also wanted to make sure that, especially folks in the African American diaspora had access to care in ways that, medical racism, like some folks just didn't believe that it could be real. Like a body is a body is a body. But if you look at where all the challenges have been in terms of the disproportionality on COVID and such, you see that manifest. And so when we're talking about reproductive care, I just watched this, important documentary on HBO just the other day, The Janes. And I was just struck by the bravery and the courage, the courage of these women who were in Chicago trying to help women access care so that they wouldn't get murdered, killed, and maimed, all kinds of things as they were accessing illegal abortions because they weren't gonna get the abortion. Okay. We cannot go back to that. And so if you have a moment after this presentation, please, I'll put the link in the chat, but watch The Janes, because this is in my mother's lifetime. It wasn't my lifetime, it was my mother's lifetime. And to imagine how my mother and women of that era had to suffer so significantly. And this is why it's so important that we need to talk about the legal protections, because this is real. This can affect our neighbors to the east. And then as they come here to Washington State to access care, it can affect them. So let me introduce our panelists today. And this is not a conversation that will be exhausted in this moment today with us right now. We will have many more conversations on this because it's so complex, and there are folks who are coming up with all kinds of ideas to criminalize people accessing important care for themselves. So Catherine West is a staff attorney with Legal Voice, and it works towards gender equality in the areas of LGBTQ rights, gender-based violence, ending gender-based violence, and access to family law. She and I know each other from our days at Northwest Justice Project, and we were in the fight together working for access to resources for folks who are poor and have limited access. And the thing about poverty in Washington State, sometimes folks forget that is incredibly complex to address your legal issues when you're just trying to get through the day's basics needs. And so I'm pleased that she's been able to build on her legal aid work there and bring her advocacy into the gender world, the gender-based world of ending gender-based violence and reproductive care, and helping with trans rights as well. Dr. Anuj Khattar is a family medicine physician and a provider who's been featured on a CNN documentary and nationally recognized voice on reproductive rights. And, it's a pleasure and an honor for you to be in our community doing the work that you do and influencing how members of our community can access the important reproductive care out there. I will tell you, as a woman who's in her mid 40s, without children, reproductive care matters to me. It matters to me, and it matters how we are able to access whether we want to have children, don't want to have children, or have organs in our bodies that just aren't working right and can affect our longevity. And so reproductive care is not just about having babies. It is part of general health care. So I'll let Milene kick it off with the first question.
Yes, ma'am.
Mhm.
So, let's see. Oh, Dr. Khattar, the first question is to you. I've read that Washington State expects an estimated of 385% increase in patients seeking abortion care in our state.
Mhm.
So from your perspective as a physician who provide these cares, where do we need to focus our energy in the legislature to mitigate this sudden influx of patients?
So wonderful question, and I think there's a lot of different ways we can approach this. First, I want to thank everybody for having me on this panel, so thank you first. So I think the biggest thing that's going to be an issue if Roe falls is a lot of states that are creating these abortion bans are also trying to prevent patients from traveling and seeking ways for people to be punished for traveling or punishing the providers that are providing care for those who are traveling. So one of the things Washington State can do is create more protections for providers and patients who seek care in regards to privacy of the care that they receive, and also protecting providers from extradition so that we aren't going to be challenged by states for providing the care that we provide in this state. We're already seeing an increase of patients from states like Oklahoma, Texas, Louisiana, where it's becoming increasingly hard due to clinics and recent laws that have been passed preventing people from accessing care. So this challenge is already occurring. So we're seeing that increase already, and it's going to increase even more come any final decision that is not favorable for states continuing to provide care. I think from a global perspective, the best thing we can do for our country is letting people access abortion care in their own states, counties, cities. So we need to figure out how to push the federal agenda to allow abortion care to be legal everywhere. I know we have to think about what we can do in the short term, but short-term solutions have never been good solutions. We need to think about the long-term solution, and making abortion legal everywhere so people can stay in their communities and receive the care they need is the right thing to do. So encouraging people to vote, because people have decided that this is a right that everybody deserves. The majority of US people want this. How do we make that happen? And that's through voting.
Absolutely. And I'm going to kick it over to Catherine, who there's a dovetail to part of what Dr. Khattar was talking about in terms of extradition, and that's usually around criminal liability. But there are folks who want to sue medical providers. What do you think we should do in the civil realm to protect providers and family members or others who are trying to help someone access the care they need?
Sure. Thank you, Representative Taylor. It's a pleasure to be here and in community with you all. I am a staff attorney at Legal Voice, but I'm required to tell you that I'm here on my own time. This isn't a Legal Voice event for funding nonprofit reasons. But To answer Representative Taylor's question, we saw come out of Connecticut was the first state to pass a bill with very comprehensive protections for both providers and patients, protecting folks from, as Representative Taylor mentioned, being hailed into another state for criminal proceedings, and also protecting patients. We saw our neighbor to the east, Idaho, tried to pass a bill last session that would have criminalized parents and providers and anyone who helped a trans or gender diverse youth obtain gender affirming healthcare in another state. So in many ways, the abortion rights access fights are very running parallel with the gender affirming healthcare fights. And so there's a group of community members discussing proposed legislation that would protect providers from increased insurance rates, malpractice claims, criminality. And, we know that we need to pass these bills because, and I should have stated at the very outset, as Dr. Qatar said, there has been no Supreme Court decision issued on this, and we do not know how the Supreme Court will rule. We know there's a lot of confusion in the community around this point. And so one at every turn to clarify that abortion is still not only safe, but legal. And we hope that this decision will not be as bad as what we saw the leaked opinion to be. But if it is in line with the thinking that the Supreme Court in the draft opinion, we know that states will need to pass very strong protections for both patients and providers. And we do expect an increase in patients coming to Washington State seeking care.
Thank you. Thank you. And I think all these conversations kind of point us back to the whole concept of having access to care, right? And so, Dr. Qatar, the recent merger between Chief Franciscan and Virginia Mason has again brought to light the issues of religious directive for Catholic healthcare services. And Virginia Mason no longer provide the elective abortion care. And it is a major hospital system in King County. So as a provider who have worked in many states, do you see investing in community hospitals, independent clinics, as the most immediate solution to this ongoing problem?
Yeah, so also a great question. And I think it's hard for me to give a very yes, this is the right thing to do answer, because I think healthcare is complicated, right? We can't predict everybody's needs. And I think for serving the most number of people, independent abortion clinics and standalone abortion clinics and putting resources into there is going to serve the most people. But there's always going to be some people who are medically complex who need to have their abortion done in a hospital. And right now, that only option is University of Washington. And with all the mergers that have happened, there's been no oversight to say you are eliminating healthcare services from these communities by allowing these mergers to occur. And I know that the legislative session has been trying to pass the Keep Our Care Act over the last couple of years. And I think that's a really important piece of legislation that we need to keep pushing for, to have oversight over what resources and healthcare access will be present in any community. And for being the largest population in our state and having only one hospital to provide that care, imagine what other places around our state are having to suffer with. So there are things we can do to prevent this from becoming worse, but I think it's going to be a group effort. And there are great funding sources like the Northwest Abortion Access Fund that are already helping people access the care that they need. We just have to have places where people can go.
Very, very interesting. these mergers they're eliminating services in communities, and it could be really problematic for a patient to go somewhere else, or complicated. I mean, fortunately, I'm in Federal Way where we have Planned Parenthood, but I've also heard from leaders within Planned Parenthood who've said that they've closed clinics in Shelton and other places where the rural areas, they have fewer access. And in terms of Catherine, like, what legal recourse can someone have if they're denied care within a certain radius? I mean, or is there anything that can be done to protect the legal resources that a person should have in terms of accessing care that's legal within the state?
Yeah, as Dr. Qatar mentioned, the bill Keep Our Care Act would have been a really strong protection for patients and consumers, but it didn't pass this session. I don't know whether it will be brought back in the coming session, but we're of course focused on abortion care, and I have raised gender affirming healthcare, but this limits also end of life care because of the Catholic hospital directives that come down. So, this crosses over, people throughout their life, and it does significantly limit care. And there are common sense solutions to address the issue, like requiring hospitals considering a merger to go through a process and disclose how the merger is going to impact patient health, access to care, and allow for a neutral body to determine whether that merger should be approved to go forward. Short of that, people are going without care. So as far as the lack of abortion access that we're seeing nationwide, we in many ways experience a similar phenomenon with gender affirming healthcare currently, because there are so few providers that provide that kind of care. And similar to abortion providers and the concerns around safety, security that they may face in the coming future, gender affirming healthcare providers are also fearing that kind of retaliation and abuse and harm. So there are a lot of policy solutions that could be implemented and could be, very smart to protect the providers that we know we have in this state and that we want to protect and have them stay here and offer the care that is life-saving and essential.
In terms of reproductive care, I mean, recently, I guess in the 10 or 15 years, Plan B has been available over the counter. And with Roe being overturned, I may not know the medical delineation between Plan B, because if you're saying at conception or the thought that there's possible conception, could it also eliminate the availability of Plan B over the counter or through the mail or through Amazon, if you will?
Yes, not only could it impact contraception, Plan B, it could also impact families who are trying to create, have children through assisted reproductive means. Some of the ways these laws are written would make those options unavailable, make assisted reproduction unavailable because of the, how tightly they are determining, viability or when life starts. And so this decision could impact so many people, not just people seeking abortion care, people who use birth control, people who are trying to create families through assisted reproduction. It touches on many parts of people's, very personal decisions that they should be able to make for themselves.
And Dr. Qatar, I thought I also heard you wanting to check in, and with that, if you could.
Oh, it was about Plan B. Plan B is not an abortion medication. It prevents ovulation, and it shouldn't be regulated that way. But again, with the language being so loose, who knows what Republican Congresspeople or conservative Congresspeople will do with those words. But I also wanted to point out that Washington State has really wonderful access to telemedicine abortion. So no matter where you live, every corner of the state, there is access. People may not know about it. How do we get the word out there?
Mhm.
The other word. So there are a lot of different places, Planned Parenthood, Cedar River clinics, abortion on demand. There are many options available for people to get their medications by mail for their abortion. So just keep that in mind. We do have a lot of access available. It just may not be exactly what each patient needs.
Hmm. Thank you. Thank you. I think, Milene, you have the next question.
Yes, I do, but then I'm still kind of dwelling on this last question. It's you were saying, Jamila, is like
Mhm.
we in Olympia doing some good troubles, but I don't think
Mhm.
we cause enough good trouble. It's 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 almost sort of like this blew my mind, right? It's like as as a common understanding, there is this separation between church and state. How the heck is it the Catholic directive services trump over the overall care
Mhm.
that should be
Mhm.
available for people is keep kind of like blowing my mind. So,
Right.
Catherine, at some point, I'm going to go to you. I'm going to say, I want the kind of bill that literally is a perfect bill because everybody's going to hate me. Because a good bill means like nobody like it, either that or whatever. But I think there's that fundamental like wrong in this whole conversations. Like if you build yourself as a medical center, as a place that you provide health care services, um, every other thing should be sort of like something else versus. So I don't know, I'm dreaming good troubles, but here's a question to Dr. Katar. So I think you touch a little bit on it. Thank you for speaking to the telemedicine. But I'm curious, I'm like pushing you a little bit more as far as how you can help, not only help us increasing access, but help all the people who's in this space right now, this Zoom space right now, to know how they can spread the word to their neighbors so they know how to access these care, because we know that abortion remain legal. And you did mention there's certain cases that's complex enough that need to be in a facilities. And so it still required traveling, it require people to take time off and childcare and all that. So do you have suggestions for us as far as alleviating some of these barriers?
Yeah, that's really wonderful. I had mentioned before there's the Northwest Abortion Access Fund. It's our local fund that covers Oregon, Washington, I believe some patients from Idaho and Alaska as well. And that gives a lot of wonderful resources to people who are having financial trouble seeking care. So number one, if you're going to donate your resources to anywhere, I think that's the best place to go. These funds have been around for a very long time and they know how to help people navigate our systems. Two, our sister state, Oregon, south of us, was able to somehow negotiate donating or giving $5 million of their funds to the Northwest Abortion Access Fund. So they're able to use state funding to be able to help patients like with this care. And it's unrestricted funding, and it's allowing this organization that knows what they're doing to do the work that they need to do. How can we get Washington to make a commitment like that to help people? It would be amazing to become a sanctuary state where patients would qualify for healthcare insurance if they needed it. when they arrived, so that they wouldn't have additional financial burdens. But I don't honestly know if that's something that's feasible or something we'll be able to do in a quick turnaround. So there's a lot of different ways that can happen. I think destigmatizing abortion, saying the word abortion, there's so many people I talk to who still say termination or ending the pregnancy or something else. Just say abortion. Abortion is healthcare. Abortion is a medical word. It's okay to say it. You're not going to be smitten for it. I think because there's so much stigma, there are a lot of people who refuse to empathize with the idea that abortion is happening even in their own communities. There's a wonderful saying that somebody I love has had an abortion, and there probably is somebody that you love who's had an abortion. They may not talk to you about it because of your ways that you feel or your moral background or whatever it is. But I think if we destigmatize abortion and make everybody realize that you know somebody who's had an abortion and you love them, like maybe that'll help decrease some of the angst that we have around this healthcare procedure.
Thank you so much, Dr. Qatar. Thank you, Catherine. Really appreciate the beginnings of these important conversations. You know, the debate is going to get pretty tense over the next year or so when we get back into session, after we get the actual court case back from the Supreme Court. And I'm going to turn it over to Senator Lisa Wellman, who's going to help us understand what's at stake here. I mean, we have a delicate balance. This is, you know, not a constitutional issue in Washington State, that it does matter who's in office to protect the rights of women here in Washington State. We are not so far, you know, to the left that this could be under attack. And, you know, again, I think I'm still traumatized by the James video where they talked about the septic ward in Chicago. Septic ward for pregnant individuals who were trying to seek abortions. So, you know, we cannot go back to that. So, Senator Wellman, can you share with us what's really at stake today?
Thank you for asking me. And I am not just excited to be here today, but I am proud to be asked to participate in supporting Representative Tai and Representative Taylor. These are two fierce women. Two women who make trouble, my kind of gals. And it is so important. Every single vote will count as we move forward with the kind of legislation that we need to put in place, we in Washington State, not only to protect the people in Washington State, but also to help those who might come to Washington State seeking reproductive care that they should have and that they may not be able to get where they are. Now, I know that both of these wonderful women have many Republicans filing against them. And there's no telling, you know, what will go on, not just from those candidates filing against them, but for the dark money that's out there that will do all kinds of things. We've all been there. We've seen it. We know what it's like, and it can get vicious. When I first ran for the Senate, now I'm in my second term, the Republican incumbent, two-time Republican incumbent, very well-liked guy, everybody liked him. He said he supported reproductive rights. He was a progressive Republican, but he voted against the bill that actually required health insurance plans to cover all FDA-approved contraceptive methods when push came to shove. In fact, I had one I'll tell you, very personal experience where I was sitting outside of NARAL waiting to see if I could get their endorsement. And they came out and they said, we'll have to call you and talk to you another time. And they went into conference because he had gone into that meeting with them and said, I know I didn't vote for what you wanted me to vote for, but if you don't support me in this re-election, when I'm re-elected, you are going to be nothing. We're going to take you out. It was that kind of thing that went on behind the scenes because they called me and they said, we had to have a board meeting to decide whether to endorse you because it's, you know, you're a new candidate. We don't know that you're going to be elected, but we've decided you are standing for what we believe in. And when push came to shove, he did not. And then they were able to endorse me. I got my message out and demonstrated to voters who the real pro-choice candidate was in my race. And I ran the race and I won conclusively. So everybody of your help is necessary for Rep. Taylor and Rep. Ty. They will need to have the same opportunity to communicate with their base and with others to push back against this right-wing attacks ahead of Election Day. As someone who, and this is very personal, but as somebody who's been through this process, who was a woman of privilege when 50 years ago I needed an abortion, I could go to where abortion was legal in the United States, if not across the United States. I got great care. And I came home, and when I worked for Planned Parenthood helping other women, I found that abortion was not fair. Reproductive rights were not fair then. And I don't want to go back to that time when women of color, the women I dealt with of color, who were made to jump through hoops you can't believe. It was gruesome just because they didn't have the money, they didn't have the access. I've seen it. We don't want to go back there. And so I personally will be giving to both these candidates today and would love to have you join me, please, in helping them get the message out. This is a vital, vital race. Every race today, every race going into this session is vital. We know the attacks on democracy, on reproductive rights, on all the things that we believe in. So I hope you'll give along with me as generously as you possibly can. We're including a joint link in the chat that supports both candidates. And so please feel free to put in the chat whatever you're inspired to give here tonight. It makes a difference. Thank you so much for being here for these candidates. And now I'll turn it back to Jamila and Milin. Thank you. Love you, sis.
Thank you. Wow. See, this is the powerhouse 41st district. I'm trying to get that kind of love down here in the 30th. You know,
we're gonna love you. We'll love you in the 30th.
Yes, I love my Senator Wilson. So I just want to see all the love all over.
Oh boy, absolutely.
I am so honored that you all were willing to be a part of this panel. Milin, your leadership and just, you know, taking action where you're going basically into the fire, where folks are just afraid to have these conversations. And we need you back. We need you back. And the support that you have from us tonight, you have the link, everyone, and you know, you can share it with your friends. This is a conversation that needs to continue. And we need to, as Dr. Qatar said, destigmatize using the word abortion. It is part of healthcare.
And then another word that we need to be really comfortable saying is a pregnant individual. Mm-hmm. I mean, affirming that is they are our people. They the people that we care for deeply. So pregnant individual who seek abortion care should be able to do that wherever they are and whenever they need to, because in the end, it's about their well-being. And when their well-being is being cared for, it truly is our well-being. And I can't thank you enough. I really can't thank you enough. And I know the time sometimes work for everybody, but please feel free to share the link. We each will need to go out there and being able to communicate where our values are, what our stands are, and our plan as far as action to protect not only the people in Washington, but the people who coming into our state receiving these services. And so I thank you, each and every one of you.
Thank you all for joining us tonight, and be well.
Thank you, everyone. If anyone would like the recording tonight, you can send an email to this email in the chat, and you can get it to someone who might be interested in what we discussed here tonight. But enjoy the rest of your evening.